Hi everybody, thank you for this opportunity to come and talk to you guys. As you heard, my name is Reitze. It's Dutch Norwegian. This is my family. My wife Miranda is a radiologist. My two boys are Joshua and Nathan. They are 6 and 4. They keep me really busy. This is what the posed photo looks like. This is what the real photo looks like. This is what it looks like every day for us at home. Just some background, I am an anaesthetist. I'm a specialist anaesthetist with a subspecialization in critical care. I've got a master's in anesthesia and a master's in health research methodology, which looks at how we do research and the quality of research. How do you evaluate that? I've got a PhD in anesthesia, and then I'm a professor at the University of KwaZulu-Natal in anesthetics, and I'm busy with a master's in Christian philosophy and apologetics. Why am I speaking to you on this issue? It's because of my background in clinical research. I take it very seriously. I have done a lot of work evaluating the quality of anesthetic literature, but also literature in general. How do we know what we know? Are the decisions that we are basing, or the data that we're basing our decisions on, is that good? I'm also a member of the Society for Evidence-Based Gender Medicine, which is an international society that's taking an evidence-based approach to the whole question of gender medicine. The caveats: I'm not a psychiatrist, I'm not a child psychiatrist, I don't treat or have experience in treating children with gender dysphoria. This is not clinical advice, and I speak in my personal capacity today and not as a representative of any organization. That's the legal stuff there on the background. All right. When I talk about this thing, at its core, I want to ask you the question, what is truth? And the definition that I use for truth is to say of what is that it is not, or to say of what is not that it is false. So Reitze has got a lot of hair. Is it the case that I have a lot of hair? No. So that is false. It doesn't correspond with what is. All right. The truth is to say of what is that it is. I'm wearing blue pants today. Am I wearing blue pants? Yes, it's true. To say of what it is that it is, or to say of what is not that it is not. Truth corresponds with what is real. And as Christians, we have a prior commitment to this. Truth is what is. Because Jesus says, I am the way, the truth, and the life. Jesus says that He is the source, the basis in which we anchor truth. God says, I am the great I am. The next question linked to truth is the question of love. And what is love? How often have you heard that question? Can you answer it? So my definition of love is setting your will to consistently seek the true good of the other. That butterfly feeling that you feel in your stomach when you see that lovely lady, that's infatuation. The 50, 60, 70 years of marriage, 30, 40, 50 years of marriage, that holds is because you've committed yourself to seek the true good of the other. And that is what God has done with us. He says, for God so loved the world, for God so set His will to seek our true good, that He sent Jesus Christ to us. And so it is loving to speak the truth lovingly. Because to lie to somebody about what is crossing the road, and you don't tell them to look left and right before you cross the road, is not to love them. If I allow my kids to eat sweets all day, not only will it drive me mad, but it's not good for them. It's not good to not discipline somebody, to tell them what is true. And so I start off my talk with this because my first statements are that a man cannot become a woman, and a trans woman remains a biological man. When a woman cannot become a man, a trans man remains a biological woman. You can't change what is. Gender is not a fully social construct. It is a biological reality. Words are not violence, and disagreement is not hate. And this is probably one of the biggest things that we need to learn, is that just because I disagree with you does not mean I hate you. And that to disagree with you is not to do violence to you. And if we are to live in a country in which we tolerate a broad range of different thoughts, religions, philosophies, we need to hold on to these key concepts. I like minions, so you're going to see quite a few of them. I just give you pause just to think for a moment about what I'm going to say. Now, when I talk about this transgender issue, there's a lot of confusion. And one of the big things that I want to do today is to give you categories by which you can think about this carefully and thoughtfully, so that when you engage in discussion with other people, you can actually bring light and not just cause a lot of heat and argumentation around it. And I'm going to give you 4 categories on which to hang your hat. I like pictures. They help me to remember. Hopefully they'll help you remember as well. The first category that I want to talk about is exemplified by Caster Semenya in South Africa. And it is the first thing that we think about as South Africans when you start to talk about trans issues. So the first category are disorders of sexual development, also previously called intersex. They're called DSD in the medical terminology. Sex is about male and female, and at its core is about reproduction. Don't let any article anywhere in the world tell you that there's confusion about what sex is. Biologically, you need a male and a female. A male provides sperm, the female provides an egg. They come together, they create a unique new life. Biologically, in mammals, that is what it is. No discussion. That's the very core of sex, is the process of reproduction. And in women, a female has got 2 sex chromosomes, an X and an X, and a man has got an X and a Y. That's it. But as I can be born with a genetic problem that I inherit from my parents, so my grandfather was bald, I've got male pattern alopecia. Maybe you do as well. I've got an autoimmune disease that I've inherited from my mom. It's a genetic condition that I've received. Down syndrome is a genetic problem that you inherit. It's a problem with the chromosomes. So you can inherit sexual differentiation problems from your parents. And there's 2 categories. One, it can be genetic, and the second one can be hormonal. So you can inherit your X chromosomes, but you can be missing your X chromosome. So over there, you're missing one of the X chromosomes. So you're a woman, but there's one of the X chromosomes are missing, and you've got Turner syndrome. You're short, you've got a shield-like chest, a wide carrying angle of the arms, short neck, short stature, clinically described by a guy called Turner. You can have an extra X chromosome, trisomy X. You can have Klinefelter syndrome. So you're XY, you're a man, you've got an extra X chromosome. These are medical conditions, discrete, well-defined, well-understood, genetic, intersex, all right? You can also have a hormonal problem. So now genetically, you are XY, as an example. So I've got the male blueprint, my genes, but when my body starts to make the hormones for testosterone or tries to respond to the testosterone, my body doesn't respond to that. My testes don't make testosterone, or my body cells don't respond to the testosterone that's being made. And if you aren't exposed to testosterone while you develop, you end up looking female. So I can be born with a genetic XY chromosome set. Genetic blueprint is male. I can have testes. I'm making testosterone, but my body doesn't respond to it. That means that when I'm born, I look female. I've got a vagina. I don't have a penis. When I start to grow, I look like a girl. When I hit puberty, my testes start to produce more testosterone. My body isn't fully resistant to this testosterone. So now the girl starts to grow taller, stronger, slightly more masculine features because of the testosterone effect, bigger muscle structure because she's got a genetic blueprint for a man. I start to run. What happens when I run? I win because I've got a genetic male structure with high levels of testosterone. And so I win at school, and I win locally, and I start to win internationally, and then they test me, and all of a sudden my testosterone levels are off the charts, and guys going, hey, what's going on? So this condition is well known in athletics, in sports, as a result of this type of effect. Women that look female but have got a genetic underlying male genetic structure with high levels of testosterone. Got it. This is not trans medicine. This is a medical condition called intersex, or disorder of sexual development. What is a Christian response to this? How is the Christian community supposed to look at this? In John 9, there's a man that's born blind, and the disciples say to Jesus, "Who sinned that this man should be born blind?" And Jesus says, it wasn't him, it wasn't his parents. This man was born blind that God may be glorified in him. So that man inherited a blind condition, a condition of blindness from his family. He committed no sin. What sin did we commit that I should be bald?
It's a gift.
It's a gift. What if happens if I've got a congenital abnormality of my heart? Who sinned that should be done? Who sinned that somebody should be born with intersex? Nobody. It's not a condition that they chose to undertake. It doesn't have a moral connotation of that. How do you respond to that? That's maybe a different question. So the disorder of sexual development is not trans medicine. But in South Africa, it's the first thing that people think about and talk about. So you'll be talking about a man that wants to become a woman, and you'll be talking to somebody that's thinking about Caster Semenya, and you try to talk to one another, and you just miss each other, and it just causes chaos. All right. Got it. DSD, disorder of sexual development. Happy? Yeah. Good. Now, the second category. This is the one that we think about, and is like the example of a trans individual. Anybody know who this is? This is Bruce Jenner. There. He's an Olympian athlete in the decathlon, won the gold medal at the Olympics for the USA, who transitioned to become a woman, or to present as a woman. She's now called Caitlyn Jenner, who in 2017 was awarded the Vogue Woman of the Year award on the front page, which I felt was quite an insult to women. So let's talk about gender and definitions. What is gender? Gender, females, women have got feminine characteristics, and men have got masculine characteristics. If you look at 1,000 men, there's certain characteristics that you can extract from them and say, this is what a man looks like. This is what a woman acts like. This is what a woman looks like. They are based in biology. In every culture in the world, no matter if they've been colonized or not colonized, everywhere there's a differentiation between woman and man in the way that they behave. And they are caricatures, because not every person fits it exactly. So I am the white South African male gender. I'm wearing my cats. I've got the pants on, and I'm wearing the open collar shirt. That's the male, right? Okay. Your children are taught in school that gender is fully a social construct. I don't know if you've heard it before or read it. As part of your life orientation skills training, every child that comes out of a South African government school believes that gender and sex are two different things, and that gender is fully socially constructed. It's a thing that we just do by chance. Trying to separate gender from sex is trying to separate the waves from the ocean. The ocean is the basis for the waves. Without the one, you don't have the other. And without biological sex, you don't have gender. This is one of the core issues at stake, this philosophical issue that you need to understand. What is gender identity? It's my sense of my own gender. I feel male. I feel female. I don't feel male or female. How do I express my gender? In behavior, in mannerisms, in how I dress. So like I've said, this is the male South African, white male South African uniform, right? I've adhered to it. If I came to you in a skirt, would you feel uncomfortable this morning? Yes. If we were in Scotland and I was wearing a skirt, more commonly called a kilt, would you feel uncomfortable? No. Because your expression of your masculinity or femininity changes and differs according to cultures. But in that culture, it's pretty clear who you are, male or female. So just because there's variation, just like there's different types of dogs, and not all dogs look the same, you still identify that it's a dog. Bruce Jenner has got what's called persistent gender dysphoria. He's a persister, somebody who continues. From the time that he can remember as a kid, he's had this uncomfortable feeling about his gender. They tell me I'm a man, I'm supposed to take on this role. I don't like it. It makes me uncomfortable. I feel anxious about it. It is an ongoing, pervasive sense of discomfort. It makes me depressive. It makes me anxious. I think about suicide, massive impact on their life. Hugely debilitating, high incidences of suicides. It starts from when they can remember. So the terminology is consistently, insistently, persistently, all the time. I don't want to be this boy. How rare is this? How often does this occur? In men, 1 in 20,000 to 3 in 20,000. And in women, 1 in 50 to 1 in 30,000. I never saw a single one of these cases while I was doing psychiatry during my training, as part of my training. There are now, at one of the high schools, about 500 girls. There are 3 transgender girls that are coming out as transgender. Something has dramatically changed. Something's dramatically shifted. As I've said, the history of gender dysphoria, it's a bad diagnosis to have. It's a terrible thing to have in your life. High suicidal rates, depressions, anxiety. And these people go to psychiatrists and psychologists and they say, please help us. I can't cope with my life. I'm unable to deal with this. So they go to the psychiatrist talk to them, they see they're struggling, they say, well, what happens if you start to dress as a woman? Does that make you feel better, Bruce? So he starts to wear female clothing, present as a woman, express a female gender. How does that work? Okay, let's now give you hormones so that you start to look like a woman. So we give you estrogen, we give you testosterone blockers. Let's have surgery, remove your testes, put in breast implants, do facial surgery so that you soften the face, look like the jawline. Does that reduce your anxiety? Does that make you feel better? What does the literature show us on that? The data shows that there are poor outcomes. The longest running studies in this out of Sweden show that the incidences for the first while there's a lot of attention and focus undergoing on you as you transition, there's a reduction in anxiety. And then after like 5 to 7 years, there's a resurgence of this anxiety, and people's suicide rates go up, their drug abuse, their anxiety, their depression resurface, and all of the problems seem to come back. So people looked at it and said, well, obviously what we now need to do is we need to start this process earlier. Because if you look at me and I start to wear makeup, implant some breasts, and I stand in front of you in a skirt, you can see I'm a guy pretending to be a woman. And so I can't pass socially. I can't pass as a woman. But if I take you before you start to undergo your sexual differentiation, before I start to gain my length and my height, my shoulder width, my facial features, you block my testosterone early, you put me on hormone therapy early, I can then transition and I can pass socially as a woman. And maybe the outcomes will be better. I will feel better in the long term. And this process is called the Dutch protocol. The Dutch were the first to pioneer this. They pioneered it in about 25, 30 children that they transitioned through this process. And in the initial studies and the initial results suggested that the patients were doing better. And so it was picked up by the WPATH, World Professional Association for Transgender Health. And this has become, inverted commas, the standard of care. It's not the standard of care because these are not randomized controlled trials. They are suggestions or proposed guidelines on how to treat people. This is called the gender affirming model. If you say you are trans, then you are trans, then we must transition you as soon as possible to allow you the best chance to pass as a woman or a man. So these early transition studies have got the same problems as what we're seeing with these long-term studies. They're showing that initially there's an improvement in how people feel about themselves, particularly through the transition period. There's still a high suicidal risk that persists around this. And a lot of people talk about the dysphoria that they experience is not actually going away, just being changed a little bit by the process that they're going through. What is the Christian response to somebody like Bruce Jenner? What is the Christian response to somebody who is undergoing this process of anxiety? Again, this is a psychological condition of anxiety and major depression, and it's life-changing, it's life-debilitating. And it's like being born with depression, or being born with schizophrenia, or a condition called body dysmorphic disorder, where I feel like my body is wrong. What is a Christian response to that? Well, it's not their fault that they have that condition. It's not my fault that I've got depression. It's not your fault that you have got anxiety. It's not a sin in your condition and how you feel about it. And our response to that should be one of love and support for that individual. But how do we deal with the problem? So let's look at trans people who have become Christians. What do trans people who have transitioned, who have become Christian, what do? They talk about finding their identity in Jesus Christ. I'm no longer a trans person. I am a follower of Jesus. They accept that their dysphoria, this sense of wrongness, is not their identity. I'm not a trans individual. I'm a follower of Jesus. They pick up their cross. They accept that this is one of the things, the difficulties that they are going to have to deal with. And this is the same as people who struggle with same-sex attraction. They say, this is something that I have to deal with. I am to submit my life to Christ, to pick up my cross and bear it. Same-sex attraction is something that I'm not going to act on. I have a friend who's a pedophile, who's also same-sex attracted. He is attracted to young boys between the ages of about 13 to 18. He sees that as a sin. His attraction is wrong. He's committed his life to Jesus Christ. He is married. He has children. He has picked up his cross. He has borne it. Your attraction to pornography, your sin that you struggle with, it's the same thing that you struggle with. You are tempted by it, but you don't submit yourself to that sin. You submit yourself to Jesus Christ. So these persons undergo this process. They generally stop hormonal therapy. So they return back to their biological sex so that you can see it. They no longer try to pass as the other sex. They generally don't have surgery again because of the invasiveness of it. Some of them will remove breast implants because of some of the risks associated with that. But they return back to the biological sex that God has given them, created them in, and say, this is who you wanted me to be. Let's deal with myself at that point. If you are a gender dysphoric Christian or you come across somebody like that in your church or in your environment, what do you tell them? How do you approach them? The first thing to say is that you are created. Our bodies are sacred. You are not a soul in your body. You and your body are an entity. We are one. God has created us as a body and soul, as a unity. And you've got a healthy, perfect, good body. Your identity is not in your dysphoria. Your identity should be in Jesus Christ. Pick up your cross. It is something that you need to walk with, that you need to bear with, that you need to bring before Jesus Christ. Don't have hormonal therapy. Don't have the surgery. When you see somebody standing in front of you like this, what is the issue? The issue is not their gender dysphoria. It is not their alcoholism. It is not their pornography. The only question is, what is their relationship with Jesus Christ? Because that lies at the heart of the root of the whole issue. That's what Jesus did. He introduced himself to people first, and then the behavior follows. It's an inside-out model. So we are to build true friendships to demonstrate God's love. If I've got a trans person standing in front of me, I'm not going to go out to try and prove a point to them. If they want me to call them Sarah or John or Steve or whatever, I will call them that. Because you don't tell me, oh no, I don't like Reitze. That sounds too male or too female. And I've had discussions with trans individuals that I didn't know were trans until 20 minutes into the conversation. So who am I going to say, oh no, you can't be a John because actually you're a Sue? You don't know. Out of respect, you talk to the individuals and the names that they give you. There are rules in our family. If you come to our family, there's certain words you're not allowed to say at table. You've got to sit and eat in a certain way. But if you come and visit us, Those rules don't count to you because you are a visitor. People that are not followers of Jesus don't have to oblige or stick to those rules. It's only when you are a Christian, when you follow Jesus, that you start to follow those rules. So don't put the family rules on those who aren't in the family. And finally, make Jesus the issue. That is the issue. That's in all of our conversations. That needs to be the issue. Okay. Persistent gender dysphoria. Got it? Lots, eh? Right. So now we've touched on two. One, castocemenia, disorder of sexual development, genetic abnormalities, genetic and hormonal, right? Like an inherited condition, my baldness. Bruce Jenner, persistent, ongoing gender dysphoria. Medical diagnosis, well understood, very rare. All right. Third category. You with me? Here we go. This is called transient gender dysphoria. Transient means it runs for a period of time and then it stops. So what is this? This are children that are going into puberty or just before puberty period, and they start talking about gender dysphoria. They're saying, I don't feel like I'm a boy. It makes me uncomfortable when people talk about a boy. Or a girl saying, I don't feel like a girl, I feel like a boy. It is so bad that these girls and boys present to psychiatrists and child psychologists because it's causing so much problem in the environment. What happens to these children? The majority of them do not persist. So Bruce Jenner is a persister. These children desist. They stop. They don't have those feelings as they continue. And look at all the studies, all the way through. It's a constant thing, a constant finding. How many of them desist? Between 65 to 85% of all children desist. Those feelings go away after they go through puberty. And there is no way to identify which children will persist and which will desist. And even the most experienced psychiatrists and psychologists will say, we were 100% sure this child would persist, and he desisted. So only those that think that they have some special anointing that are able to identify these children that are going to persist, or who have deluded themselves in what's going on. What's happening with these children? A lot of these children have got other psychological issues or psychiatric issues. Autism is very common in these children, particularly among boys. Autism is a way of looking at the world in a very fixed, rigid category. So, for example, men wear pants. No discussion in an autistic child's mind. Men wear pants. I don't like pants. I can't be a man. If I wear a dress, I am a girl. That's how they think about it. Very rigid characters. So when they say, I don't like dressing in a certain way, I don't want to be a boy, it's often because of the rigidity of the categories that they work in. A lot of those children have got a homosexual, same-sex orientation at that age, and so they don't fit into their group and they feel uncomfortable, or they're being picked on and they're feeling bullied and they don't identify with that group. So those incidences in those groups, high incidence. In girls that have been abused, high incidence of not wanting to be a girl. Because if I'm not a girl, I can't be abused, because if I'm a man and I've got a position of power, I can protect myself. So in this field, there's a massive confluence of a lot of different things, and a small portion of them are Bruce Jenner. This comes from the Dutch, a guy called Steensma. These guys pioneered this Dutch method. They say, before the age of 10, we suggest a cautious attitude towards transitioning. Some girls who were almost but not entirely living as boys in the childhood years experienced great trouble when they wanted to return to the female gender role. We believe that parents and caregivers should fully realize the unpredictability of their psychosexual outcomes. We don't know what's going to happen to these children. The number one rule in medicine is don't cause harm. If I don't know what a drug's going to do, don't give it to somebody because it can hurt them. The second rule is don't experiment on children or vulnerable populations. So up until recently, the approach on these children is to be wait. Let's see what happens. Let's see what happens with the children. Where do they go to? Don't harm them. And this has now been supplanted by what's been called the affirmative approach that I showed you, this WPATH guidelines. So they're taking data from the Bruce Jenner group of people, 1 in 30 to 1 in 50,000, and applying it to this group of children. And there are big problems on that. So what they do is they give children puberty blockers. So it's drugs that block either your estrogen function if you're a girl or your testosterone function if you're a boy. And so the child stops growing. His brain stops maturing. The skeletal tissue stops growing. They become stunted, more different from the rest of the population from their group. We don't know what the implications of this stuff are. The only research that's been done on this is the use of puberty blockers in children with cancers or precocious puberty when they start going into puberty because of abnormalities early on. We don't know what happens when you use it on a child that's growing normally. And the interesting thing is that once you take a child and you put them on the puberty blockers or you start to socially transition them, almost 100% of them turn into persisters. So you take the 65 to 85% of children who would stop, you start treating them as a gender dysphoric child, and you turn them into somebody that's going to sit with this problem for the rest of their life. The evidence base for treating these children in this way is incredibly weak. The UK, the Swedes, the Finns, the French, the Cochrane reviews, all of them say this data is weak, it's poor, it's based on small studies, they're observational studies, they don't have long-term follow-up, they're all warning about what's going on. Karolinska University in Sweden, which has been one of the leading proponents of this process, has said, whoa, we don't know what's going on, we don't give puberty blockers to children under the age of 16, we don't know about the long-term effects of this. We don't know about the ability to make informed consent. How well is your 16-year-old able to make decisions about her future or his future, about the clothes they want to wear, about the iPhone or the cell phone that they want, where they want to go to university? Now they have to make decisions about their long-term fertility, their sexuality at the age of 13, 14 years old. They will only do this stuff in the terms of a clinical trial, in which there's oversight, we can see what the bad complications of this are. How do we respond as a society, as a church, as a Christian community? Number one, protect the children. I can see no way that if I try to do a clinical study using this type of background and it wasn't in the trans medical field, there's no way that I would get this through any ethics committee. The watch and wait process is the way to go. It seems to be reasonable, it seems to be safe. If you are going to transition, it must be done in a clinical trial so that we can learn from it and we can identify problems if they occur. And again, if that child is in your class, in your school, in your church, how do you respond to them? You respond to them as Jesus would, with the gospel, because that lies at the root of the thing. Persistent transient gender dysphoria. DSD, Castor Semenya, intersex. Persistent gender dysphoria, Bruce Jenner. D-sisters, young kids that are confused, the majority of which of them grow out. And now this one. And this is the one that's caused the huge anxiety, what's happening in the schools today. So this has been coined rapid onset gender dysphoria. Rapid onset, it happens quickly. Dysphoria, the sense of uncomfortableness. This is happening, it's a totally new thing. Never seen something like this before. Totally new category, totally new clinical presentation. It happens in girls predominantly, tenfold more than in boys. Remember that originally, more common in boys than in girls? Now, almost predominantly in women. Girls between the ages of 14 and 18, and they happen in clusters. So they move from females to males. They're often got some type of grouping. They're at this class, in the same class, on the same WhatsApp chat group, the same social circle. They're playing a sport together. They're in some type of thing, online communities, gaming communities. They've had no prior history of gender dysphoria at all. Up until a year ago, the mom will say, this child played and was happy to be a girl, never had an issue. All of a sudden, it appears. It has the features of a craze. all of a sudden, out of nowhere it happens. It's a high social value action. So somebody that is low on the socioeconomic, the social scale at school. So you're slightly awkward, you're slightly out of it, you're a little bit on the corner, a little bit of like a tomboy. All of a sudden you come out as trans and you move up because it's a brave thing to do. There'll often be one or two people around you that also become trans. Around that will be another little cluster of gay, lesbian, seeking, bi-spirit, non-binary. And they will create these little groups, and it will often spread through a school or through a community like a wave. Underpinning this is this gender ideology that says gender is not your sex. So imagine when you went through puberty. How confident did you feel? How cool and smooth did you feel? Like your arms and legs and bumps and lumps and things are growing and not growing and you're all over the place. You don't feel masculine, you don't feel feminine, you just feel confused. That's puberty. And now you jump online with this type of experience, and maybe you're being pushed out by your social peers because you're a little bit overweight and you don't quite fit the stereotype of the cool girl or the cool guy. And online they will tell you, oh, you're confused about your gender. The rule online is then you are transgender. If you think you are transgender, you are transgender. And so gender is something that we make up. It's not something that you grow into because it's just a social construct. So you should transition. And the faster you transition, the better it's going to be for you because all of your feelings will go away, these bad feelings. And so they medicalize what is a normal process of puberty. And they target particularly those girls and boys that are struggling with other issues like depression and anxiety. And it's very similar to what we've seen in the past where you've had these outbreaks of anorexia or bulimia or children who do cutting. That type of constellation, those type of individuals are particularly susceptible to this. It's very strongly linked with the radical gender ideology, LGBT woke movement. You'll often see it following quite soon after that. Some of these guys even reject the need for having a dysphoria. Because if gender is a social construct, why do I need to feel bad about my gender before I change it? Why can't I just change it? If it's just something that you make up, why should the doctors be acting as gatekeepers and trying to prevent me from being who I want to be? Why can't I just start taking testosterone and having surgery just because I want it? And it's very strongly linked with a very aggressive activism. Which why I put that stuff in my talk, why I and friends and colleagues have been the target of attacks around this. Because if you don't agree with it, then you hate, which I categorically reject. There's room for disagreement with respect, and it's something that we should fight for and stand up for. Steensma, the surgeon, says, we don't know whether the studies that we did in the past can be applied to this time. We did all this research on Bruce Jenner. We did some research on the transients. Can we take that research and apply it to what's happening to the girls in high school? Many more children are registering and a different kind. Suddenly there's so many more girls than what there are boys. Remember initially, more boys than girls? Now 3 times as many girls as boys. This is a book written by Abigail Schreier. She talks about irreversible damage, the transgender craze seducing our daughters. She's a liberal, and she writes from the experience of seeing her children, her friends go through this thing and saying, what is happening? What is happening to our girls? How they're being damaged physically, psychologically by this process. Okay. This is Rachel Levine. She's the U.S. Secretary for Health in the Obama administration. She said, there is no argument among medical professionals about the value and the importance of gender-affirming care. The WPATH guidelines, which say you must accept what the child says and then you transition them. Now, I'm going to ask you, can we take the data from Caster Semenya and apply it to the 13-year-old in your high school? Is that an appropriate way to think, to reason? Can we take data from Bruce Jenner and apply it to this child over here? Can we take data from this child and apply it to Caster Semenya? No. The categories are different. The populations are different. Our understanding of what's going on is different. This is not the same as these. These have a commonality, but transients are not the same as persistent. And nobody knows what the heck's going on here. And to pretend that you do know, in my mind, is to be deeply unethical and irresponsible in the way that you're handling it. And is it true that every medical professional agrees that the affirming way is the way to go? Well, I'm a medical professional. I'm an anaesthetist, admittedly. So what about other people? Well, Steensma says, these are the guys who pioneered it, say we don't know if these studies can be applied because the population has shifted. So the Dutch say there's a problem. The Swedes have said no. I've shown you this data from the Karolinska University. This is their national board in Sweden. They say no, we don't know what's going on here. Increasing reports of detransition, transition-related regret. We don't know about the hormonal risks. You may only transition if you're in a clinical trial. What about the Finns? Research data is limited. We need more data. We need more information on the disadvantages, on the regret. They urge caution. England has just brought out a review overseen by a pediatrician called Dr. Cass. She says the evidence is inconclusive nationally and internationally. Longer-term follow-up data are needed. No definitive advice due to gaps in the evidence base. They've just closed what's called the Tavistock Institute, which has run a lot of this stuff in the UK. The French, great caution must be taken given the vulnerability and the many undesirable effects and serious complications. Greatest caution is needed in the use of the puberty blockers, impact on growth, bone weakening, sterility, emotional and intellectual consequences, menopause-like symptoms in girls. The Australians and New Zealanders, there's a paucity of evidence on the outcomes of those presenting with gender dysphoria. There's a need for better evidence. The clinical reviews, weak evidence, insufficient evidence, low certainty, unknown effects. What Rachel Levine is saying is presenting a seamless narrative around this that is massively informed by an ideology. It doesn't reflect the reality because these state organizations, health organizations of governments, generally don't have a political axe to grind. They're responding to what the evidence is showing. And as I've said, there are now close on 1,000 former patients that are looking at bringing a class action lawsuit against the Tavistock Gender Clinic in the UK because recklessly prescribing puberty blockers with harmful side effects and adopting an unquestioning affirmative approach to children identifying as transgender. It's like a craze. This is what's happened in Sweden. After they started to explore more of this, particularly after a documentary that followed 3 girls, they called it the Trans Train. 3 girls that presented with gender dysphoria, that were jumped onto the Trans Train, transitioned, they came off it at the age of 18 and said, what the heck did you do to me? Following the Karolinska Institute's reports, and you can see the numbers shoot up and plummet. That's like a Pokemon card craze. Everybody wants the cards, everyone wants cards, and then nobody forgets about it. Except that instead of having a stack of Pokemon cards here, your fertility is destroyed. You've had breast reduction surgery, you've taken away your breasts, you've been on hormonal therapy, you've got constant issues, if you've had mastectomies, then you may run the risk of constant pain. You may never be fertile again. So when you hear statements like this from Rachel Levine, I urge great caution. And in South Africa, hopefully it will be published this month, we've written a letter of warning to the psychiatric community in South Africa, not saying anything new, just repeating almost word for word what all of these organizations are saying and say, slow down. It's not about us. It's about those individuals, the children, and about moving carefully and slowly with regards to them. And if there's one thing that I want you to take away from this talk, it's this. Transgender issues are not homogeneous. They're not all the same. They are different. You need to think about them and talk about them carefully like that. And you need to realize that what's happening in your high schools and your primary schools is not the same as the other things. So, what is real truth? To say of what is that it is not, or to say of what is not that it is false. And to say of what is that it is, and of what is not that is not, is true. That is reality. It's based on what is real. And Jesus makes this audacious claim. I'm the way, the truth. I am what is real. If you want to show people what is real, what is true, you need to show them Jesus. And if you seek to give or show true love, not some sentimentality, not letting people get away with over what makes them feel good. You want to show true love like Jesus showed for us, that he went to the cross to die for us. He set his will to seek our true good. For God so loved the world, so God so set his will to seek our true good, that he allowed Jesus Christ to come to die for our sins. And so if you want to be a true Christian, you want to show God's love to the world, we need to speak both truth, and we need to speak that truth in love, in a loving fashion. Thank you very much. Questions? Yes.
I know some of the answers to these questions, you kind of touched on them, but I'm looking at a layman's level. The first thing I'm asking myself, why is it common now? We haven't seen this in the past, and it is just much more. I saw you've explained on the teenagers and the 14 and 18s, but it's a concern and a question that how do you explain to an ordinary parent what is happening now? The second question, how do we help parents to understand who find themselves in this situation where they have a child that have suddenly displayed this kind of, I don't know whether I should say, a behavior. Then the third question, as the community and the church, I know you've explained that we must show love, but it's still a shock and it's still unacceptable because of the way we've been brought up. How do we respond now that we have these people or these kids in reality on a day-to-day basis?
Okay, so let me first start by answering the question, what is happening here? So what we are seeing in our society, in our schools, is it's the point of a cultural shift. So the West, and to a degree South Africa, has always seen itself as a Christian nation, in inverted commas. So the whole of Europe, the whole of the US is seeing itself as Christian. And with that, there's a certain way of understanding the world. So what we think that we can know what is true. We believe that there's a God that has created, that there's an order to the world. What we are seeing now in South Africa and what we're seeing in the West, and particularly in the US, is a shift away from that, where those principles are not true. There is no God. You cannot know what is right and wrong. There's no God that determines what is right and wrong. The only thing that determines what is right and wrong is power. And if there's no God and there's only power, then there's this consistent power struggle that's going on. And the people with power are bad, and the people without power are good. And so all of us that are white, I don't have any disabilities, I'm heterosexual, I am a problem, I'm an oppressor. And those that are different from me, that are other colors, that are disabled, that are trans, that are homosexual, they are oppressors. And that narrative is what's happening in the schools now. And at the extreme of that is the trans community. So the trans community believes that there is no God, I can make my own reality. And if you tell me that I am wrong, you are oppressing me because you have power and I don't have power. And that is what your children are being taught at school. They are being taught that these things are normal and are morally acceptable. So to say that marriage is between a man and a woman only is to be hateful. So a Christian doctrine that is foundational to Christianity, to say that marriage is only between a man and a woman, is hateful. And they're taught that. And I say that because there is a God that has created order. I can see it in nature and I can see it in Scripture. But neither the community, the society rejects those totally. And we are actually the problem. I am the one that is hateful to say that. I should be silenced. I should be shut up. So in that environment, your children are being raised in that environment. And so when they go to school, they will be taught, look how marginalized the trans community is. Look at the high rates of suicide. Look at all of this. Look at all of this. And the reason for that is the hate that the power structures that we put in place for it. And we need to be silenced and stopped, and they need to be empowered and lifted up. So on that environment, the training that your kids are getting at state schools predominantly, also private schools, then you jump online, and your feelings of what I'm going through puberty, well, that must be trans. That's what's going on. So that's why you're seeing an explosion of it. It's why the church, the schools, our society need to be aware of what's happening in the times. That if you just do nothing but stand on what you believe is true, you're going to be progressively more and more out of society and more pressurized. So that's the first thing to say, is that's what's driven it. How do we respond to this? So the first thing is, in your family, you need to know what's been happening is happening in your schools. The most important subject that you can be aware of your child is learning is life orientation. Because what they teach and the philosophy that underpins life orientation is completely at odds with Christianity, but also what I would put down to like classic concepts of what a humanity is and what people are, the integrity of individuals, that I respect you irrespective of your background. We all share a common humanity, and as an individual, I respect you for who you are, not which group you're part of, anything like that. That's what Christianity, those principles, they are embedded in that. That viewpoint in life orientation is pushed away. So you need to be teaching your children against these things, purposefully and thoughtfully. My kids are 6 and 4. We've had a discussion about, can a mom and a mom get married with one another? Well, you can't. From a Christian perspective, a man and a woman cannot get married. In South African law, it's not a marriage either. It's a cohabitation. It's a social contract that they have. It's not marriage, because marriage is a biblical prescript. We believe that God has ordained it. It's between a man and a woman. So I have that discussion with my boys. Is, can a man become a woman? What is a man? Why is it a man? Those are foundational discussions that you need to have from a small age. Unfortunately, we have to have these discussions. Then as your children start entering into that phase at 13, 14, when they start asking the questions, it's not enough to say mom says it or dad says it or the teacher says it or the Bible says it. You need to show them why it's true. Show them the argument for the truth of Christianity. Show them the argument for the consequences of getting the things wrong. What are the consequences? What happens to trans people when they undergo this? Does it relieve their anxiety? Does it relieve their pressure? That's you as a parent. In the school, you need to be standing up and you need to keep activism out of the schools. The school is not a place to get a political education. The school is the place to get educated. And what's happening is a lot of the schools is that there's this ideology that's being fed in that is particularly against Christianity. You cannot wait for your school to educate your child. You need to be part of that process. You need to be on the board. You need to be attending parent-teachers meetings. You need to be saying, this school must cater, if you're a public school, for Muslims, Hindus, Christians, and atheists. Just as I'm not allowed to push my religion down on you, so you are not allowed to push your religion down on me. How do we respond to the LGBTQ plus community? With respect and with love. If you wish to follow this lifestyle, in South Africa, you're fully free to do that. You can engage in any activity you want to within reason. You cannot do it on the school premises, just like I'm not allowed to engage in these activities on your school premises. I'm not going to affirm that lifestyle because I believe that is detrimental to you. It harms you. But I will stand up for your right to attend any place you want, have the free speech of it. So you need to be actively engaged in creating a community in which we have true tolerance, not the tolerance that is oppressive and being pushed down. And the churches need to be aware of this. You cannot teach your kids at primary school, at Sunday school, about Jonah and the whale up until the time they're 18 and then send them to university where they will run straight into this. You need to start to teach them about these issues now. You can only do that if you know it. So, and then I think the big issue is, what is the church going to do? Because it's an uncomfortable place to stand here and to say the things that I've said now. Because you're going countercultural to what the culture is moving. So I am bigoted, I'm homophobic, I'm transphobic, I should be silenced, I need to be shut up, I need to be cancelled, contact the guys that I work for, shut them down, contact the university, revoke this from me. That's what I'm expecting to happen. And that's a hard thing to do. And this is the process of the church and the followers of Jesus being separated from those that aren't. But we are called to be a voice of truth, and we're called to be a voice of love. And I don't want to be here in these discussions. I'm an anaesthetist. You heard my research field is in people that have surgery, and here I'm talking about transgender issues. Because somehow God has brought me into this field, I wish that somebody else would come and do it. So you need to understand the cultural shift. You need to respond to that as an individual, in your own family, in the school that you're in, and then in the society. And maybe the final point that I would say is that if I've seen one thing is that you need to start pulling together as the church, the true church of Jesus, because you cannot do it by yourself. I'm part of a group of guys, academics and sort of philosophers and apologists that are involved in a lot of this stuff. And without their support and knowing that they are with me in the battle, it's like 5 or 6 people that are praying for one another, that we encourage one another, that we just stand. You don't need to do something funky, you just need to stand. Without them, I would be wiped out. Like I wouldn't be able to do this stuff. And if you look at the persecuted church in the past, stories out of Russia and Romania, it's all about us just standing in community with one another on the promises of Jesus Christ. And I think maybe that's where the media, the Christian media, has that role to play, is to say, you're not alone. Because that sense of, I can't handle this, you're not alone, you're part of the community of Jesus Christ. And the wonderful thing is we win the battle in the end. It has already been won. All that we need to do is just stand there. More questions?
Do you think as Christian media we should put this kind of stuff on air? Or should we just preach Jesus and hope to win them to Jesus, in other ways, winsome ways, maybe alluding to these things, but like a speech like yours today, do you think it's a culture that it can go out there, or would you say no?
Well, so firstly, I'm standing here, and you're recording it, and my recordings have been online. And in fact, I try not to do these talks without them being recorded, because what I have said and the way I have said it has been done carefully and thoughtfully. Because what I have said is true. And sure, there may be some issue around interpretation, and we can discuss some of these issues, but what I have said is true. And just because it's in conflict with what you think you know or you want to believe doesn't mean that it's hateful, or there's no hate speech in this. To say that something is harmful for somebody and to be able to demonstrate it is not hate speech. So we are called to be watchmen on the wall. The watchman doesn't just watch, he calls out when he sees something wrong. If the church in South Africa is to stand, it needs to speak. The hate speech bill needs to be challenged. There needs to be a test case that goes to court on the issues, and it needs to be tested against the concept of free speech. Now, to call for the genocide of a people is hate speech. But this ideology, this movement, this acceptance movement will try and use that as a tool to oppress and to shut down everything that people don't like. If we allow that to happen, then South Africa as a functional democratic society is toast. Because what happens if another population comes into control? What happens if it becomes a atheist government and says, well, we're going to shut everything down that we don't like? It becomes a weapon, which is what everybody has said about the hate speech bill and the concerns about it. So irrespective of what the bill does, there will be a test case. It needs to go to court. It needs to be tested against the Constitution. Pray that it's not you, but God might choose you to be that person. Then the second point is, if you shy away from being the watchman, God will take you away from it. Because you are not speaking truth. You reject who Jesus Christ is as truth, and you reject his love. And what is Jesus saying? He is in of his nature, in his very person, offensive to us. He says, you are lost. You have sinned against God. You are doomed for destruction. But I bring you the good news. He brings good news. You don't have to face any of that. That is redemption. You cannot be redeemed from something if you don't know that you're lost. You cannot just preach salvation, because what are you being saved from? And remember, they killed Jesus after 3 years of him preaching. If you've been on air for 30 years, maybe you're doing something wrong. Anything else? Thank you.